Hospitals scramble to stay ahead of the wave of patients the coronavirus is expected to unleash. Many are taking drastic steps they never would have envisioned to head off this fast approaching enemy. News Channel 2's Jolene Ferris reports live tonight on what's being done locally. Jolene.
Thank you, Kristen. MVHS has suspended some of its services, relocated some of its own patients, and bought nearly 300 additional beds to deal with that anticipated wave of downstate coronavirus patients. On Tuesday, MVHS officials had a conversation with the governor and state health commissioner that highlighted the magnitude of what is going on with the coronavirus.
It was a very sobering conversation. The number of positive COVID-19 patients doubles in New York almost every 3 days.
In anticipation of a downstate need that will likely have to be met with upstate hospitals, MVHS is taking drastic, sweeping steps.
Our surge plan, as delivered yesterday, does include a 100% increase in the number of patients on an inpatient basis we normally take care of at the St. Luke's campus where we're standing today, and a 75% increase at St. E's.
And they say they can ramp up to that level in 9 weeks, a shorter time period than the state is allowing.
We have already ordered, I think, 270 beds, working with the Mohawk Valley Hospital Supply Company to expedite the delivery of these beds. We are taking rooms that have been mothballed for years or used for offices to transition them into patient rooms.
MVHS has also had to transfer some of their own patients to accommodate the anticipated wave of coronavirus patients from elsewhere.
We have also closed down our inpatient pediatric unit because we are going to be using that space for our surge plan. We have very few pediatric patients, very few. And so for the time being, we're going to turn those into adult beds, and children will go to Syracuse.
One thing they don't know is when they'll start getting these patients, how many and in what order, before or after Albany gets some. What about Buffalo, Syracuse? They can only assume and hope they'll be staggered.
It is possible that they'll send some to Albany before us, and then their capacity increases, they'll send more, ours increases, they'll give us more, but we really don't know. We just have to be prepared.
And coming up new at 6, we talked about extreme circumstances. Can an expectant father be in labor and delivery with a mom who's giving birth? And what about people who have a loved one who's dying in the hospital? More on that coming up new at 6. Back to you for now.